Hello and welcome to yet another edition of your weekly international current affairs program, Globewatch, from the Cameroon Radio Television, with me, Charles Bunde, from the Hilton Hotel here in Yaoundé. 23 years on, Gavi, the Global Alliance for Vaccines, remains one of the key mirrors to ensure that communities around the world have a healthier system. Of course, it is one of the key founding principles of the institution, which has ensured that children around the world are saved through vaccines and immunization programs. Apart from the global front against HIV and AIDS, malaria and tuberculosis, it is one of the key partners supporting governments across the globe in ensuring a sustained healthcare system to achieve the United Nations goals, Sustainable Development Goals by 2030. My guest today on Globewatch, the first is the former Prime Minister of Portugal, former President of the European Union Commission, today the chair of the Global Alliance for Vaccine, Gavi. And just after him, we will be receiving the World Health Organization Director for Vaccines and Immunization on this program. José Manuel Barroso, bonjour. C'est un réel plaisir de vous avoir sur les antennes de la Cameroun Radio Television.
C'est un plaisir, merci pour cette opportunité.
De ma connaissance, c'est votre troisième déplacement au Cameroun. Il y avait un déplacement en 2016 pour une conférence économique investie au Cameroun que vous avez participé. Est-ce que je peux savoir les raisons qui motivent votre présence au Cameroun en cette fin d'année 2023?
Bon, c'est une visite dans le cadre de Gavi, l'Alliance globale pour les vaccins. Et c'est la première fois d'ailleurs que je visite un pays de l'Afrique subsaharienne dans cette qualité. Et je viens avec une très importante délégation. Vous savez que nous sommes une alliance, nous avons l'Organisation mondiale de la santé, l'UNICEF, la Banque mondiale et aussi d'autres partenaires comme la CDC ou CHAI, la Clinton Initiative, pour la santé. Et je viens essentiellement pour trois objectifs. Le premier, c'est célébrer notre partenariat avec le Cameroun. Nous avons un rapport très ancien avec le Cameroun, immédiatement après la création de Gavi, et on a beaucoup soutenu le Cameroun. Deuxièmement, c'est aussi pour garantir qu'un message passe, que c'est le message en faveur de l'investissement dans la santé, soit dans l'immunisation, soit dans la résilience des systèmes de santé en général. Et troisièmement, un message plus spécifique qui est le message de besoin de rattrapage du retard qu'il y a en matière d'immunisation de routine. Comme beaucoup d'autres pays, ce n'est pas un cas spécifique du Cameroun, surtout à cause du Covid et à cause de la crise économique et tous les problèmes. La vérité, c'est que la vaccination de routine des maladies qui sont traditionnelles est en retard par rapport à ce qu'elle était avant le Covid. Alors, nous sommes là pour voir comment est-ce qu'on peut rattraper, surtout pour ce qu'on peut appeler les enfants zero dose, dose zéro, qui n'ont accès à aucun vaccin.
Depuis les années 2000, lorsque Gavi est créé, jusqu'à aujourd'hui, c'est presque 1 milliard des enfants vaccinés dans le monde entier. C'est presque 16 millions de décès évités. Lorsque vous regardez ces chiffres, vous dites que pendant 23 ans, Gavi a fait quelque chose de formidable dans le système de santé mondial.
Là, le chiffre que vous venez de mentionner, environ 1 milliard, même plus maintenant, d'après nos dernières statistiques, c'est seulement ce qui a fait Gavi, parce qu'il y a aussi d'autres efforts, surtout dans les pays développés.
Il y a le partenariat mondial pour la santé,
voilà.
ainsi de suite.
Mais Gavi, qui a une concentration très forte sur les pays en voie de développement, et surtout dans le cadre des pays en voie de développement en Afrique, nous avons garanti ou appuyé la vaccination de plus de 1 milliard d'enfants. Donc on estime, il y a différents modèles de prévision, qu'on a environ presque 17 millions de vies sauvées. Donc c'est vraiment, on est très fiers de cela. Et bon, c'est une mission d'une très grande importance d'un point de vue humanitaire, d'un point de vue humain. Je crois qu'il n'y a rien de plus important que la vie de nos enfants.
En dehors des retombées positives en matière de sauvetage de vie, il y a un autre aspect que vous ajoutez au sein de Gavi, la prospérité économique, parce que, comme vous venez de dire, dans les pays en voie de développement et en Afrique subsaharienne, par exemple, il y a environ 220 milliards de dollars qui sont sauvés annuellement pour protéger les économies de ces pays à investir dans la santé. Ça aussi, c'est un aspect crucial pour vous? Bien sûr,
oui, vous avez tout à fait raison. C'est bon de rappeler, surtout aux gens qui parfois hésitent un peu dans ce domaine, que ce n'est pas simplement important d'un point de vue de santé, d'un point de vue, disons, humanitaire, mais c'est aussi d'un point de vue économique rationnel d'investir dans la santé publique, et surtout dans l'immunisation. C'est démontré, parce que pour des modèles économiques qui sont connus, que $1 ou un CFA ou un euro investi dans l'immunisation rapporte beaucoup plus, parce que ce sont des soins de santé après qui ne seront plus nécessaires, ce sont des coûts dans les hôpitaux et dans les systèmes qui sont épargnés, et sont effectivement des conditions de santé qui aident aussi la production, la productivité dans les économies. Donc, à part la raison humanitaire, la raison qui tient à la vie même des gens, il y a des raisons économiques qui montrent que l'investissement dans la santé est un bon investissement d'un point de vue économique, et dans le cadre de la santé publique, l'investissement dans l'immunisation est celui qui est le plus stratégique, parce qu'il faut prendre en compte cela. L'immunisation, c'est très souvent, par exemple dans votre pays, le premier contact qu'un être humain, qu'un bébé a avec le système public de santé. Aujourd'hui, j'ai visité ici un centre mère et fils.
Et enfants de la Fondation Chantal Bier.
Voilà, mère et enfants. Et il y avait là énormément de mères qui attendaient avec leur bébé la vaccination de leurs enfants. Alors, ça veut dire que c'est la première fois que cet enfant, donc cet être humain, a un contact avec le système de santé, c'est là. Et la façon dont nous arriverons ou pas à l'intégrer, à montrer que c'est important, le mieux ce sera après pour la santé de cette personne, qui est aujourd'hui un bébé, mais qui sera un adulte. Donc c'est vraiment stratégique l'investissement dans la vaccination.
Vous venez d'évoquer le Cameroun. Je me rappelle que lors de votre dernière conférence il y a 2 ans à Londres, le président Paul Biya avait envoyé comme contribution à Gavi $1 million, environ 650 millions de francs CFA. Est-ce que vous pouvez me dire l'intervention au Cameroun de Gavi en système de santé? Simplement immunisation?
Non, écoutez, le Cameroun...
Quel est votre rapport avec le Cameroun?
Tout d'abord, nous sommes très reconnaissants à cette contribution du Cameroun. C'est un des très rares pays africains, de l'Afrique subsaharienne, qui donne une contribution financière, ce qui est important, pour montrer l'attachement à notre action. Ceci dit, nous sommes en train d'appuyer énormément le Cameroun. On peut dire que 70% du coût des vaccins au Cameroun sont financés par Gavi. Donc c'est vraiment... Et maintenant, pour le vaccin contre le paludisme, on estime ça à plus de 90%. Donc nous avons déjà un partenariat de longue date avec le Cameroun. Et nous l'avons parce que nous voyons qu'au Cameroun, il y a une détermination là-dessus très importante. Parce qu'il y a une volonté des autorités, à commencer par le chef de l'État, mais par le gouvernement, de faire face à ces défis par une action plus déterminée dans ce domaine si fondamental de la santé. Donc c'est pourquoi nous avons depuis longtemps ce partenariat que d'ailleurs nous voulons renforcer avec votre pays.
You are coming to Cameroon equally coincides with the arrival of the new vaccines to fight against malaria in the country, about 31,000 doses of them, and you have been working throughout the day with the Minister of Health. Generally, in Africa, how has Gavi worked to help the health systems?
So first of all, as you said, it's a coincidence. I do not come because of that vaccine.
Absolutely.
There are many other things. We have a big battery of vaccines that we are deploying. The so-called routine immunization, from measles to yellow fever to polio. So it's not specifically. But
and
it's
even
true.
during COVID, you hugely played a role in ensuring that communities around the world, particularly in Africa, have access to vaccines from manufacturers.
Exactly. Most of the vaccines received by low economies, low revenue economies, were given by Gavi through COVAX, that we created that facility.
Yeah.
Yes. So, and now you integrated the vaccine against COVID in our routine immunization program. But it's true that it coincides with the introduction now of a new vaccine that was already certified as safe and as effective by the World Health Organization. It's one vaccine against malaria, which has been, as you know, one of the most deadly diseases here in Africa in general. So I think it's very, very important. So, and in Africa there is a great interest and demand for that vaccine. In fact, what we already sent to Cameroon is more than 300,000 of these vaccines, and now it's of course for the authorities here to see how and when to distribute them. So it's a huge thing, and there is a huge interest from Africa. I've been receiving some calls from heads of state and government asking for that vaccine to come as soon as possible, because it is certain that it will reduce the level of mortality that we have, namely in children.
Okay. One but last question, Mr. President and board chair of Gavi. Gavi is an alliance. You network with so many partners, countries, multilateral institutions whatsoever, the Gates Foundation and whatsoever. How does that partnership work for vaccines to reach the poorest of communities in the world? Because basically your job is to make sure that the poorest of the communities in the world receive those vaccines for their kids, for their children, for the poor people to be saved.
Exactly. It's a very interesting model indeed. It's quite interesting that you ask me that, because some people don't know. We are an international organization, but made of other organizations. So it's an alliance, as you said.
Yeah.
So we have the founding members of the alliance, of Gavi. It was the World Health Organization, UNICEF, and World Bank. Also the Bill and Melinda Gates Foundation. So already there, public and private partnership. But then we have 5 countries that represent the 5 constituencies of the donors. We have 5 countries that represent the developing countries or implementing countries, those where the vaccines are actually distributed. We have 2 representatives in the board of the vaccine manufacturers, one from the so-called Global North, another from the Global South.
GSK, for example.
Yes, it changes.
Pfizer.
It changes.
I'm just giving an example.
Yes, but also we had, for instance, from India, other representatives. And we have one representative for research institutes and universities that are focused on this research. One from the civil society organizations.
So it's an assembly of the best experts and people with authority that
and independent members like myself. I'm independent. I'm not representing my country or representing any specific group.
Absolutely.
I'm trying to put that together.
Yeah.
And so, and our model is a public-private partnership, which is very interesting because it has the solidity of something that is public for the public good, but also with some agility that you find in the private sector. And quite importantly, it is an organization that is focused on concrete concrete results. So what we do afterwards, we procure the vaccines. So basically Gavi, together with our procurement partner UNICEF, we guarantee to the companies that they will have sufficient market, provided they give us the vaccines at the best possible price. So that's a condition. And then with the money from the donors, either public, either governments or private or charities or philanthropic donors, we put them at almost zero cost to the developing world. That's the model. But we only distribute vaccines that have been pre-approved by the World Health Organization.
What message, as the boss of Gavi, do you have to your partners, to users of vaccines around the world? What clear message do you have for them? As you know, the flow of information, it's not always on the same direction.
Yeah, exactly. What I ask people to do is to be informed objectively. Not
because
to
you
trust.
combine economic knowledge, you combine leadership, you combine experience, and you combine expertise.
That's very kind. To look for the best evidence, the science. Of course, we cannot know everything. So what we can do, for instance, Gavi, we have to rely on the best science that we have, for the best experts in the world. And we have them through the World Health Organization, from Europe and Americas, but also Africa. Africa has already very good experts in this field, in immunology. And so I know that sometimes it's difficult because there are those groups of WhatsApp and others that just circulate some kind of things that they have imagined, or sometimes conspiracy theories, paranoid theories, but they are not true. So we have to base our decisions in the best information available, objective information, and also with evidence, concrete evidence. It's now demonstrated, it's known that vaccines have saved millions of lives. I mean, if you look, and there is empirical evidence of that. So countries that have vaccinated their children, the children is a very low mortality rate. Others that have not vaccinated, they have incredible high numbers of casualties. So it's a clear evidence that vaccines make a difference. So what we ask is people to look at evidence and not just trust some, let's say, gossip, a negative gossip that appears in some kind of disinformation. I don't call it information, I call it disinformation.
And with that, we conclude the interview. The former president of the European Union Commission, former Prime Minister of Portugal, I should remind you, if you have forgotten, that back in 2016, you were my guest.
Yes.
And we were seated in this same hotel here in Hilton.
Yeah.
And I can remember that it was in the month of May, and we had a conversation about the then coming US elections. And I told you that Americans were going to elect Donald Trump as president, and you said that probably was not going to happen. We are just 1 year away from the next US elections. I don't want to dive into such predictions again. Joseph Manuel Barroso, thank you very much indeed. It was a pleasure talking to you.
My pleasure. Thank you. Thank you very much.
Thank you very much, Mr. President.
Thank you.
Professor Kate O'Brien, the World Health Organization Director of Immunization, thank you very much for talking to the Cameroon Radio Television.
It's such a pleasure to be with you tonight. Thank you.
I think everybody watching us now will probably like to know the role of vaccination and immunization in saving lives across the world, because I know that each year at least 4 million deaths amongst children are prevented through vaccination and immunization.
Yeah, you know, vaccines are life-saving products, and that's why every single country in the world has a vaccine program to protect infants and children, as well as adolescents and pregnant women and adults from diseases that can be prevented from vaccines. And you're absolutely right. We estimate that around the world, there are 4 to 5 million deaths that otherwise would happen if the vaccines that are being received by people were not received.
And each time vaccines programs are currently going on around the world, there is a lot of controversy. The WHO is the world's medical doctor. How do you explain such a psychological issue all the time?
Well, first of all, I really want to start by saying that when you talk to parents of children who are newborns and are growing up, in fact, it turns out that people want vaccines. They understand the value of vaccines. In fact, those of us who are adults now have benefited either because we were vaccinated, and we don't know among us which of us would have been those who would have died in childhood. Or if you weren't vaccinated, you're benefiting because many others around you were vaccinated. And as a result, the diseases that we vaccinate against find it harder to move between person to person. So I want to first say that although we talk a lot about people who are questioning vaccines or the misinformation of vaccines, the truth is that the vast majority of people are very supportive of vaccines and want their children to be vaccinated.
Okay.
But that's not to say that we're not really concerned about this environment that we find ourselves, all of us, in right now, not only about vaccines, but the misinformation that is around on social media. And people who have honest questions aren't really sure where to get information that's accurate.
We'll talk the misinformation in a moment. On the eve of COVID-19 in 2019, the World Health Director General, Tedros Ghebreyesus, used to be my guest, an interview done from the Nigerian capital, Abuja, and we discussed some of these issues. One of the vaccines that raised a lot of controversy was, of course, the COVID vaccine. Today, do you say COVID is over?
Well, COVID is with us forever. COVID is not over. But what's happened in the last 4 years is that when COVID started, it was a new virus. Nobody in the world had been infected until it started. Nobody had immunity to this virus. We're 4 years on into the presence of the virus. Virtually everybody in the world has been infected at some point, whether they got serious disease or whether they were infected and had mild disease or in fact no disease. And we have almost 70% of the world's population that has been vaccinated. So we're in a very different place now, 4 years later, in terms of the immunity that we as individuals have and as our families have in our communities. That's why we're in a different situation. However, for people who are in older age groups, I'm included in that age group, for those who have underlying medical conditions, we're at greater risk when we get infected of having a serious disease.
Now let's talk one of the diseases considered the world over as one of the major killers, which of course is malaria. And you have put into the market a new product or a new vaccine, Mosquirix, which is going to kill so many of the pathogens that kill so many people. In simple English, protect so many lives around the world, especially in Africa. What is this new vaccine against one of the world's deadliest diseases?
Yes, so malaria, I would say everybody on your viewership is very familiar with the disease malaria.
Sure, absolutely.
And
it should be the country's first killer.
It is the dominant killer, and especially a killer of young children. It has been a very difficult disease to develop a vaccine against. There have been dozens of attempts to make a vaccine that actually works. It's been about 30 years of concerted effort to try to find a vaccine that will do the job.
Through research.
This is research that we're talking about, scientific research. And there's been so much progress made that, in fact, we do have a vaccine that has gone through all of the research that was needed in order to make a decision about whether it should be recommended for use in the program of immunization. That's where we're at right now. And I want to really emphasize that that research program wrapped up about 10 years ago. And there were still questions about how could the vaccine be used. So there were 3 countries that wanted to use the vaccine in the regular program, not a research program. And those countries are Ghana, Kenya, and Malawi. There have been 2 million children who have received the vaccine, about 8 million doses that have been received. We have a huge amount of information about the effectiveness of the vaccine and its safety. And we know that this vaccine works to prevent against severe malaria and to prevent against death. And it's a safe vaccine.
The success story of the new vaccine in the countries that have used it, as you say, Ghana and others, seems not to quickly move in the same direction. Cameroon should be the latest to receive at least 31,000 of such doses to help protect the children. And I'm sure that you must have had conversations throughout the day with policymakers, and they ask so many questions, maybe based on what they see on social media. Why do you think that people are skeptical with the new arrivals?
Well, let me explain a couple of things. It's only recently that there's been the opportunity for countries that would like to introduce the vaccine to have access to the vaccine. And that's because the information over the 4 years when the 3 countries were using the vaccine needed to be collected. And as WHO...
Analyzed.
Sorry, analyzed, yes. Collected and analyzed, thank you. We have done that. We have convened the world's experts on the issues of vaccines in general, on malaria in particular.
And the certification experts.
In addition to that, we also have a program where WHO looks at the manufacturing of vaccines, and it reviews the quality
big names
of
like the GSK
vaccines.
and others.
Absolutely. So we have a program where we do that, and this vaccine has received what we refer to in WHO as pre-qualification of the vaccine. In other words, we are endorsing the quality of the vaccine.
So the data you collected, you analyzed based on World Health Organization standards that ensure that they are good for human consumption, for application, for vaccination, for immunization programs across the world, are sufficient, according to you, to tell Cameroonians, my audience in particular, that this is good for the protection of more children, right?
Yes, this is exactly, you've given a good explanation of this, yes. And then it's up to countries to decide, is this a priority for the country? It's ultimately the decision of the country, the leaders of the country, the health leaders, to decide whether or not this is the product that they want to invest in.
From a general perspective, everybody said that COVID-19 took us unawares, including the world's leading agency on health, the World Health Organization. With what happened with COVID, are you more foresight in management, vaccine production, immunization programs around the world to make sure that we don't have another calamity of such a nature?
You know, during COVID, the world experienced the worst pandemic in 100 years or more. And the world did not do enough. The world didn't do a good enough job to assure that vaccines and other interventions were shared equally around the world.
Okay.
We're convening the opportunity for countries to negotiate with each other a new pandemic agreement. And we look forward to supporting countries around the world who are having that discussion now about benefits of things like vaccines, but also treatments and diagnostics, so that there is a fairer world, a more equitable world. In the meanwhile, our job in the immunization community is to assure that children in countries who most need vaccines are the ones at the front of the line.
And with that, we conclude the interview. The World Health Organization Director of Vaccines and Immunization, Kate O'Brien, thank you very much indeed for being guest on our program.
My pleasure. Thank you so much.
You are welcome.